Hey guys, our next pathology we're going to talk about is atherosclerosis. And what that is, it's a hardening or thickening of the arteries. So I have an artery here, so not a great drawing, but you can kind of see the fatty buildup in the vessels. And what happens is over time, that fatty buildup, that plaque, is going to cause the arteries to harden and prevent blood from getting through eventually. It can even lead to clots. Um, Again, we talked about kind of the cause. A lot of it can be genetic, lifestyle related, risk factors like smoking, diabetes. All those things can lead to this, as well as aging. So no smoking, it's the biggest risk factor. I've got a little cigarette and some tobacco up here. Um, the effects on vitals, we just talked about this in the previous video, but atherosclerosis is going to cause our blood pressure to increase, potentially and most likely our heart rates to increase as well. Um, Essentially, we're probably going to be put on if you have this, the same medications as you'd find with somebody with high blood pressure. So our ACE inhibitors, beta blockers, calcium channel blockers, and diuretics. Just depends on what your doctor says. But I also want to talk about coronary artery disease, our next pathology, because essentially coronary artery disease is atherosclerosis in the coronary arteries of the heart. So again, if this gets bad enough, those arteries can get blocked with that plaque, and then blood supply isn't getting to that part of the heart, and that's what leads ultimately to a heart attack or even a stroke as well if it's a blood clot that's in the brain.